The floor is yours, Chancellor Merkel.
Thank you, Director General, dear Tedros, dear Ms. Bachelet, dear Mr. Ban Ki-moon, dear Ms. Swaminathan, ladies and gentlemen. I would like to thank you, dear Tedros, for inviting me to speak at the WHO's Global Evidence to Policy Summit. When a disease develops into an epidemic and then into a pandemic, we have every reason to seek the advice and counsel of science. What kind of pathogen are we confronted with? What needs to be done at the local, national, global level in order to contain the infection spread? How can we make sure that we share the findings and evidence and the measures that have proven effective as quickly as possible? At the end of 2019 and the beginning of 2020, we knew but little about the SARS-CoV-2 virus. However, coronaviruses were not an unknown quantity. In Germany, research had been ongoing on this since 2006. And once again, we were reminded of how important it is that there is a network in the field of health research. I'm very grateful to all the expert teams at the global scale that have shared their knowledge with everyone in order to quickly decode the virus. As early as by mid-January 2020, we had the first PCR test providing us with diagnostics. And in less than a year's time, we were able to develop effective and safe vaccines. That was indeed a milestone in pandemic management. And as the German Chancellor, of course, I am pleased to note that German experts also had a hand in this. However important it may be that scientists establish networks, they also need to have a good rapport with politicians. In any event, we need to ensure that we provide sufficient national and international research support. Progress with regard to research, especially in an area that affects our health, should and must be that important to us. Unfortunately, though, not every country is able to provide for the necessary research capacities to the desirable extent. And it is this that illustrates the global importance of the Global Initiative Act Accelerator and its vaccine pillar, COVAX. On the one hand, we have been able to provide financial support for research into vaccines, therapeutics, and diagnostics. And on the other hand, we have provided poorer countries with vaccines. The G20 countries also committed themselves to further improving global access to urgently needed vaccines, therapeutics, and diagnostics. In so doing, we are moving closer to the goal recommended by WHO, and that is to make sure that a minimum of 40% of all people in all our countries are being vaccinated by the end of 2021 and 70% by the mid of 2022. In the medium and long term, we also have to continue to work to ensure that vaccines are not only produced in industrialized countries, but also in other countries, for example, in African countries. Undoubtedly, we will be facing new health challenges time and again. Thus, even a modern health system like the German health system has to be continuously developed further. For example, during the pandemic, we quickly noticed how important it is to further improve our reporting system, to start with the GPs, the laboratories and the health offices, all the way down to the Robert Koch Institute, our central institute for health monitoring and disease prevention. Undoubtedly, digitization plays an important part if we are to get a comprehensive picture of the infection's spread and activity. The interlinking of information and as clear and complex an overview are of elementary importance if we are to optimize our methods to treat and prevent the disease and the virus. But it's also important for political decision making, and that is why it's always been important for me to consult and ask the advice of experts from the fields of infectiology, immunology, the health system, and also from the field of ethics. For if we are to successfully fight the pandemic, we have to act as a society, and we need to provide the adequate political framework. If we are to shed more light on present and future infections and diseases, if we are to find the right answers, we need to develop and set up suitable platforms that allow for an exchange between scientists and politicians, between scientists and scientists too, not only at the national level, but also at the international level. I also believe that we need to be better equipped when it comes to find out more about where the diseases and epidemics have originated. And thus I welcome the fact that in setting up SAGO, the WHO Scientific Advisory Group for the Origins of Novel Pathogens, we're setting up a new unit of researchers that will be cooperating over a longer period of time. It will be their task to brief WHO about the emergence of new or novel pathogens. This will be of assistance, helping politicians to get at an earlier stage information regarding potentially alarming pathogens and thus be in a position to respond more quickly. Information and advice and counsel rely on data from areas like the environment, fauna, geography, sociology, and last but not least, from the health sector. The interdisciplinary and international collection, monitoring, and analysis of these data is no easy task. The more pleased am I that with the WHO Hub for Pandemic and Epidemic Intelligence, we are about to set up a new space in Berlin where data to help prevent other and further pandemics and epidemics will be analyzed, in which we can also develop the required instruments and test them. AI in particular can help us detect new connections in sets of data, thus allowing us to further research this area. The WHO Hub in Berlin will use these possibilities and these means and share any findings and insights with all the member states. In so doing, we will be able to earlier and better detect health threats and provide a basis for policy making. Allow me to summarize finally what in my eyes is of fundamental importance. 3 points. First, we need to make sure that there is more cooperation and more networking in the field of science, in the field of politics, but also between scientists and politicians. Second, we need efficient and effective structures. In order to achieve this, we need to place the financing of the World Health Organization on a reliable foundation. After all, WHO, as the coordinating body in the global health architecture, plays a central part. In addition, the mandates of all organizations and actors in global health should be clearly aligned. And third, we need to make sure that we further strengthen trust, because trust is an indispensable precondition of excellent cooperation. Pandemics know no borders. Shared challenges like pandemics can, despite national efforts being undertaken, only be overcome if we act together and cooperate. Instead of acting alone, we stand much better chances to successfully stand up to the horrors of pandemics. The present pandemic, with its catastrophic health consequences and also its impact on our economies, should serve as a lesson to us. We should build networks, structures, and trust. In so doing, creating the preconditions for our and future generations to better and more speedily respond to such health threats. We would also be well advised to lay down specific measures for better prevention, early detection, and response in a pandemic treaty or a similar legal instrument, and to lay it down in a binding manner. I think you have more than enough to discuss today, and thus I wish you a fruitful exchange of views during this summit. Last but not least, I would like to thank you all from the depth of my heart for your commitment and your contributions. Thank you.
Thank you very much, Chancellor Merkel, for your inspiring words.